Now I am going to demonstrate the procedure ascitic large volume paracentesis. So now I want to explain some basic principle about the ascitic tapping. First we need to know which quadrant is having a more fluid. So usually we can do it by the ultrasonography imaging we can do, but if we don't have a bedside ultrasonogram, then we can do it by clinically, we can assess by the percussion method. So you start from the percussion from the umbilicus and then to the below the lower quadrant. So definitely you will get the dull note if fluid is there, so that we can assume there is a fluid and we can prick. So before going to the procedure, first we need to select a area which is the best to do the ascitic tapping. So we have to mark the first. This is the anterior superior iliac spine, and this is the symphysis pubi. So usually we will do the ascitic tapping lateral to the pubic symphysis, just 2 centimeters, and this medial to the anterior superior iliac spine. So it's the midway between, we will choose any area. The ideal site is the suprapubic area, but we don't have any imaging, so there will be chances of bladder puncture will be there. So we will select the safe areas like the right or left lower quadrants of the stomach. So before going for the procedure, so I will demonstrate how to follow the aseptic precautions for the procedure and all. First sterilize your hands. Take a sterile gloves. So this is the anterior superior iliac spine and the symphysis pubis. The midway between this is the area. So we need to prick here. So I have to clean this area in a circular manner, starting from the middle. Do it in a circular fashion. We can use either betadine or the surgical spirit, and we will clean the site. And just take cover with a whole towel at the area where you have selected to maintain the site sterile. And before doing the procedure, the main thing is we need to avoid the pain to make the patient comfortable. So we will take a lignocaine injection, the 2% lignocaine injection for the local anesthesia. we'll take a 4 ml of lignocaine injection and just identify the site and go deep and withdraw a bit, and there is confirmed it is no vascular, it's not in the vascular supply, and instill the lignocaine in a hole 360 degrees. Come out and infiltrate intradermally, subcutaneously all the planes. Instill the lignocaine. So for the aspiration of fluid, first use a 10 cc syringe to know whether the fluid is coming or not, and we have to collect the sample in this sterile 10 cc syringe for the culture, and there should be a bedside inoculation to get a better yield for the culture. So, and doing the procedure we need to follow one technique, it's called the Z technique. The main principle for this Z technique is there are the skin layer and the both peritoneal layer will be there. Both the holes we are doing should not be in the same plane. So, we will follow the Z technique. So, we can avoid the leaking of ascitic fluid post procedurally. So, that is the most important step doing the ascitic fluid tapping. So, we can follow a 2 techniques to achieve the Z tract. So, either we can keep a finger like this and we can retract the skin, and we can go 90 degrees to the skin surface, 90 degrees to the skin surface, that is one technique. Otherwise, directly we can go initially with some angulation and then make it a 90 degrees and go straight. These are the 2, whichever you are comfortable you can follow those things. Go please. So, as easy I am going to do, just this is the point where we have to probe. So, just pull up the skin and keep the needle and go perpendicular to the skin, correct 90 degrees to the skin surface, and aspirate. So, now we are in the peritoneum, we got the ascitic fluid. So, we have done under aseptic precautions. So, we need to inoculate on the bedside for this culture, especially when we want to send it for a culture, we need to inoculate the so we have to connect, sister. So, we need to connect to the IV set, which will drain into the container. And we have to fix the needle with the help of the plaster, and we need to inoculate this culture into the culture bottle bedside only, so the yield will be good. The minimum sample required is 10 cc for the culture, and we can collect for the TC/DC sample from the pipe, no problem. A last, thank you. The samples for the diagnostic purpose, what all the samples we have to send is the first important is the TC/DC to know whether there is any spontaneous bacterial peritonitis or any other secondary bacterial peritonitis. So, that is the most important, and then the protein albumin should be sent to calculate the serum ascitic albumin gradient, which will relieve whether it is an exudate or transudate fluid. And next is we can send for a cytology. If we are suspecting any malignance, to look for the malignant cells, we can send for a cytology. and microbiology, the culture sensitivity we can send, and if it is if you are suspecting a tuberculosis, you have to send for the ADA, and the ascitic fluid sugars also can be checked. So these are the things basically we will look in the ascitic fluid.